Good afternoon and welcome to the Seminole County August 26th COVID update. Hope and trust everybody is doing as well as we possibly can. Want to make sure everybody know today is National Dog Day. How about that? A little bright light in the midst of all the things that are going on. We want to thank the media for being here, for helping us get the word out of what's going on with all the aspects of COVID, including our CARES program here in Seminole County. We appreciate those folks continuing to be here to get the information out for us. We also want to thank the frontline responders, our people at the hospital that continue to work every day with these COVID patients that show up in our hospitals. In my last briefing, I understand most are, if not all, are back to regular services, which is good. We want to make sure those people in our community that aren't COVID related but have other medical needs, get those needs met. That is, of course, a testament to the continued vigilance of our community and our business people who continue to do everything in their power to fight the spread of COVID-19. Today we're going to talk a little bit about the CARES funding. As many of you know, the state of Florida has allocated $82 million to Seminole County, and this is to be intended to address the economic consequences due to the COVID-19 pandemic. Seminole County Board of County Commissioners has approved Seminole CARES, a comprehensive relief package supporting county businesses, residents, not-for-profits, and local government entities. That means all 7 cities. So the county is working with all 7 cities. We know they are separate municipalities, but they do have COVID impacts and costs associated with that. So the county is the tip of the spear, if you will, for the distribution and gathering that detail and information so that those cities become reimbursed for all those COVID-19 impacts. Seminole CARES proposes 100% of the initial disbursement of CARES Acts from the state of Florida be allocated towards the county businesses and the residents and nonprofits hardest hit by the COVID-19. The County Commission thus far has allocated $10 million to Seminole CARES small business grants, $7 million towards individual grants, and $3 million towards nonprofit grants. Last week we launched the application portal for businesses, and since then we've had over 3,300 applications that have created accounts, and we have 1,458 businesses that have completely submitted applications. This morning at 10 a.m., the online portal for Seminole CARES Individual Assistance Grants opened. Within the first minute of the site opening, we had 200 applications in the queue. To date, 6,000 CARE applicants have created profiles so far. So that's since this morning, 10 a.m. until 1 o'clock, 6,000 individuals have went into the portal and attempted to get their applications in. 20% of the applications who've created profiles have received confirmation emails thus far. The county and its contractor are very aware of the delays and technical areas encountered with the email confirmation process. So what we urge you to do, we know we've had a technology issue on the volume and the amount of those trying to get in. I think in today's world we all know and understand updates and technology sometimes can be challenging. Our staff as well as our contractor is fully aware of that, and they're working feverishly to rectify that problem. Applicants should not repeatedly try to create profiles or click the submit button over and over. If you continue to do this, it just continues to build the queue and makes it longer before you get a confirmation email. Once you get the confirmation email, you will be able on your own to go to the website and verify that your application has been submitted. But I would urge you, I know it's human nature, if you don't get a response, you want to keep making sure that your application got in. We're aware of them coming in, but we're delayed in getting the confirmations back out. Bear with us, we'll get that out as quickly as humanly possible. There is going to be a delay in the email flow. Applicants should await their confirmation before revisiting the portal. Residents who are business owners should apply for one grant, either business or residential, and not both. You're not eligible to receive both grants. That's been a common question. We've noticed that there has been some individual requests that have already made business requests. So we want to ensure for individual grants, the maximum amount of assistance provided per household is $5,000. Funds can be used for rent or mortgage assistance, utility assistance such as gas, electric, and water utilities only. Up to $200 in gift cards for food or basic needs. Payments will not be made directly to qualified residents, but rather to the mortgage company, landlord, or utility provider. Only one individual per household may apply. Support hotlines have been established last week to better assist applicants. Please do not call our hotlines to report delays or errors with email confirmations. Back to what we were just talking about. We know there is a confirmation delay. Continuing to submit your data is only going to delay that further. The Small Business Support Line is 877-298-3539. The Individual Support Line is 877-330-1818. The Board of County Commissioners understands how critical Seminole Cares individual grant funding is to your family and is committed to ensuring the eligible recipients get the assistance as soon as possible. It is our hope to provide funding to all eligible applicants. If additional CARES funds are allocated to Seminole County, we will, of course, backfill those needs. Updates will be posted hourly on our social media outlets as new information is available from our site engineers. We appreciate your patience while applying for the Seminole CARES funding. Shifting away from CARES, we want to recognize the 10 Seminole County firefighters who are now deployed as a regional task force to assist with the swift water rescue in Baton Rouge. As many of you know, last week we activated our EOC for these tropical weather events, and fortunately for us, it is not coming our way and has now gotten into the Gulf and is moving towards our neighbors to the west, Louisiana and Texas area. So what we have done is we've deployed the Swift Water Rescue Team from Seminole County to help our partners in that Gulf region. So we appreciate those folks, providing those services for our fellow states. Godspeed, Urban Search and Rescue Task Force 4. Our prayers are with you and our assist with our hurricane response on the Gulf course. Moving on to COVID-specific updates, joining us today is Seminole County EMS Medical Director, Dr. Todd Husty. He'll be followed by Ms. Donna Walsh from the Florida Department of Health. And also we have Alan Harris here, our head of the EOC, that will be here to take any questions you may have. With that said, Dr. Husty, welcome.
Thank you. Thank you very much, Chairman Zembower, and thank you all for listening up. I'm going to be really short, which is really unusual for Dr. Todd Husty. I got some kudos for wanting to do the mask mandate early. I just listened. I graduated 40 years ago from medical school, and it just seemed like the right thing to do is to wear a mask and to social distance. So I don't know. Yeah, I take credit for being the loudest mouth, but that's about it. If you really want to make me quiet, do this. So if you see in the red, that is where we have the mask mandate, the beginning of the red, and we went 14 days for an incubation period and started looking at blue again. And if you notice, it goes down pretty drastically. That's thanks to you all. That's thanks to the public finally going, okay, this is for real. If we don't do it right, it does what happens before that red part. It goes way up. And then when you do it, it goes way down. Masks work, so does social distancing. I really hope we never close down businesses again, because I don't think we're going to have to. I kind of want to personally thank everybody, because I hadn't been in a grocery store for 2 months. And when this started happening, I went, people are wearing their masks, they're social distancing. I said from the beginning, people wearing masks creates more freedom for more people to do more things. And that worked for me personally. So thank you all for doing the right thing. You made my life much better. And I'm a new grandpa as of last Monday. Thank you. Donna Walsh.
Thank you so much, Dr. Husty, and thank you for your continued leadership and guidance through this response. As with every week, I just wanted to provide everyone an update on where we are in the state of Florida as well as here in Seminole County. And as you just heard from Dr. Husty, things are improving significantly. This tells a story here. I know we talked about flattening the curve back in May, and we all experienced exponential growth, as you can see there in the peak. The incubation period for this particular coronavirus, is 2 to 14 days, and it is pretty evident that after that mask ordinance came out And after the first incubation period, after that mass ordinance, 14 days, we started to see a decline in the number of cases here on a daily basis. So many thanks to our county for leading the way and making sure that this virus does not spread in our community and cause illness and death. So in the state of Florida, we've had a total of 608,722 positive cases as of today, and 10,733 deaths, unfortunately. Here in Seminole, a total of 7,839 cases, with a total of 169 deaths, unfortunately. A good many of those deaths are in our most vulnerable population, as we have mentioned before, our elderly. And so we continue to try to protect those with underlying health conditions and those of older age, because those populations tend to be most affected by this virus. And it takes all of us working together to protect our community. Right now, we are following 692 current active cases. So even though we've had a total of over 7,800, 692 are currently active, which is encouraging. Over the course of this response, we've had 550 hospitalizations, but today, 77 current hospitalizations. So again, a vast improvement from what we were seeing back in June, July. Our positivity rate overall has been 10.56%. As you might recall, back in May, we were down hovering around the 2% positivity rate since the onset in March of this response. However, I will say that our daily positivity rates are going down significantly. So yesterday, for instance, our positivity rate was 3.93%. Again, very encouraging. If you look back for the last couple weeks, the week of August 19th to the 25th, our positivity rate was 4.78%. The week before that, 5.32%. So we are seeing a decline there. So some encouraging numbers, and that's all of you working together to keep this virus from spreading and to continue to use those non-pharmaceutical interventions that we've talked of, the use of masks, social distancing, and also good hand hygiene and other hygiene practices. So to date, we have tested over 74,000 folks here in Seminole County. We will continue to provide testing. As we shift into September already, I can't believe that, but as we shift into September, the health department will continue to provide testing, but on Tuesdays and Thursdays, and we're actually trying to accommodate those who are working, so we will provide the testing over the lunch hour, 11 to 1 o'clock. In the event that we see that there's need for further testing, we will certainly expand the testing. Of course, the Home Depot and Oviedo will continue to test daily, so that's another option for folks, and that's every day of the week that ends in Y, right? So Sunday through Saturday. Very helpful. And then our community partners, True Health, will continue to test. They do offer testing a limited number every day at their facilities Monday through Friday, Castleberry, and co-located at the health department there in Sanford on Airport Boulevard. Again, if there is more need, we will certainly work with our community partners and provide further testing in the community. We are looking at, so far, through the course of this event, 16.61 cases per 1,000 population, or 1,661 cases per 100,000 population. But if you look at those numbers for today, with our active cases, 692 that we're following, that would be 1.4% per 1,000 population that are infected with this particular virus. So that kind of puts that into perspective for you. We are still, as schools open, we are still concerned about our pediatric populations. Although the number of cases so far in the state of Florida for those less than 18 years of age have been a lower percentage than the other age groups, we still have, for the whole state, almost 49,000 cases reported in those less than 18 years of age, and of those, 611 hospitalizations. We have also had reported deaths in some pediatric patients in the state of Florida. Fortunately, no reported deaths here in Seminole for pediatric patients. So with those, for the state, 2 were in the 5 to 10-year-old age group, 2 in the 11 to 13-year-old age group, and 4 in the 14 to 17-year-old age group. There have been also about 50 cases of reported multisystem inflammatory syndrome in the state of Florida, and those cases were 12 in the 0 to 4-year-old age group, 30 in 5 to 14, 8 in 15 to 18, and 1 in a 20-year-old. So we continue to be vigilant and work very closely with the congregate facilities within our community, and that includes daycares, schools, long-term care facilities, and group homes. This is where people are more likely to get closer together. So, we work with folks, especially the school system, in maintaining those protocols that have been established before schools open to maintain that 6-foot distancing, the use of mask if you're, certainly in a close proximity, and the use of good hygiene. So I would just commend our community. I commend everyone who has worked so hard to keep this virus from spreading. We want to keep seeing this flattening of the curve. We are getting reports of an average of about 30 to 40 cases a day right now. That's different than in May when we had 0 to 5 cases reported daily. We want to see this go down to near zero, folks. So besides vaccine, the interventions that we have available to us is exactly what you've been doing: the social distancing, the facial covering, and the hygiene. So thank you all very much for all of your support. If you do have questions about COVID virus or about testing, please remember to visit prepareseminole.org. You can also call the Seminole County Citizens Information Line at 407-665-0000 or the Florida Department of Health at 407-665-3000, option 1. Thank you so much.
Thank you, Donna. Thank you, Dr. Husty. With that, we'll be happy to take any questions that you have for us today.
Concerning CARES, Jay, I know that it was first come, first served. It's $7 million, which, this much that sounds like a lot of money. It's also a limited amount of money.
Absolutely.
So I guess your message is that if you've sent your stuff in, even if you haven't received a confirmation email, trust that you're in line. When people hear first come, first served, they need to trust that they are in fact in line?
Yes, correct. The question is, on the individual CARES, should you trust that once your data has been submitted, is it in the queue, and will our people get back to you? Yes, the answer is yes. Once you've submitted your data, there's no need to regenerate or repopulate or resubmit any of your information. Our delay truly is on the technology of getting back through the email process with a confirmation. Staff assures me, and our assisting program directors are telling us that this will get solved relatively quick. So you should start to see probably by tomorrow. Most everybody that is having trouble should get a confirmation, or we hope gets a confirmation, but there's no need to keep submitting.
Well, to follow up on that, so one of the fixes with the schools, because they had the same issue.
Right.
People would submit their option choice, but they wouldn't get a confirmation email. The fix there was to go back in and look at your child's student number, and you saw that you submitted. Is there a way that they can get in the system to show that they have been received?
The question is there a way to go in and see if your information has been received to verify that? And there is not a method until you get a confirmation. Once the confirmation is, then yes, you will be given the information. You can go in and make sure that your information has been uploaded and is in our queue. Now, with that said, you also can call the support line at 877-330-1818, but I would caution, do not call that immediately after submitting your application or even today, because we're not going to have an answer. Chances are we're not going to have an answer until late this evening or perhaps tomorrow, when all the applications have already, again, we've had 6,000 as of now, and we suspect we're going to have at least that many more by the end of the day.
So you're really asking people to have faith that they did it properly.
Absolutely. Have faith that the system is working. I would say if you've not heard anything in 24 to 36 hours, then maybe that's the time to make the call. So, anything else?
This question is for either Dr. Husty or Donna. There are quite a few people out of the school district that are being quarantined. How many positive cases do we actually have in the school district? Do we know that?
Sure. As you all know, we're working very closely with our school district. And the reports of cases that we've gotten so far are community acquired. Obviously, the incubation period hasn't been long enough since school opened to see any transmission within the school system. So far we've received reports of 21 students and 4 staff that have been positive in about 17 different schools. throughout. So we're working very closely, as I mentioned. What I would emphasize is for parents, teachers, faculty, staff, that if you're a known contact to somebody who tested positive, they're a confirmed case, and you have no symptoms, please follow the recommendations to stay home and quarantine for 14 days. Sometimes we're finding that folks, because they feel okay, they're going to school. And then that potentially exposes others if they eventually test positive. So, I would just ask everybody to please adhere to those quarantine and isolation recommendations, and that will certainly help everybody.
Could I add on to that, Donna? Your words were very good, but we know from previous experience is that people feel a little bit ill and go to work. Their kids might act a little bit ill and they go to school. This is different. This is very, very different. We really have to toe the line. I know it's uncomfortable, 14-day quarantines, a long period of time, just because there's been some possible exposure, or if somebody wakes up and doesn't feel good. I just heard from a firefighter whose wife was pregnant and felt badly. She just figured, it's probably pregnancy. It wasn't. She was COVID positive. So please, we have to really double down on if you don't feel well or if you've possibly been exposed, please stay home. It's the only way to keep this going in the right direction.
Todd, if I can expand on something that I probably have asked you this question since we started talking about masks a million times. The numbers look good. You say people are doing the right thing, but that should not mean it's over.
It is not over, Dave. I appreciate it. We have talked about this many, many times, and that is the message. And that's why we're so glad media comes to this, is because it's up to you. We can hit a small segment, but it's really up to media to get the word out that this is because everybody's doing well. And as Donna said, is that this isn't good enough yet. We went close to zero or zero. I mean, that's really manageable. So if we have some people who have to be quarantined because there's been some exposure, fine. We can handle that. And it's just, we don't want to go back up to there, to where it was really bad. So don't let your guard down. Please keep doing everything appropriately until we get to zero or very close to zero. We'll let you know. We're going to be singing in the streets.
One more question. So we continue to see more cases in our schools. Do you believe it's going to be like a breaking point that would force the schools to close?
I don't see that happening for a couple of reasons. I don't see, the question was, is are we going to see a breaking point with the schools reopening and the exposure that is going to go on? I mean, we knew that going in. That's why we were trying to be so careful. And everybody in the school board and the health department have been so careful. We're going to track everybody. So, yes, we're going to have people out quarantined. And that's going to include teachers, which is difficult, because that's when you go, will we have enough teachers to keep the school open? On the other hand is that we do know that the teachers can be at work with their masks on, do everything appropriately, just like with firefighters. If they've had a mild exposure, they can go back to work if the workforce needs them, just like at hospitals. Quite frankly, the hospitals and the fire departments are pretty good right now. We're worried about what's going to happen to the schools, but going back to work after a mild exposure with full PPE on is very, very safe. We know that. We know that from watching the fire departments, watching the healthcare workers. So I think we're a long ways from really getting that concern of we're going to have to shut down the schools. I don't think we're ever going to reach that. But thank you.
Okay, quick update. Just in the 20 minutes that we've been on this press conference, we've now queued another 375 personal assistance applications. So this assures the public that we continue to have a functioning system. Again, please be patient with us, and once you get your verification information, you will be able to check online. One other thing I wanted to make sure that everybody heard today, there's been some discussion. We are working and have reached out to legal aid. We're going to be working on a eviction mitigation program here in Seminole County. We know as people have lost their jobs, have lost their businesses, or have been greatly reduced, we continue to see, this desire or eviction, of which the state has given us another mandate order, which is not quite as stringent as the first one. So we're concerned about those individuals that may find themselves, in an eviction process. So again, on behalf of the county commissioners here in Seminole County, as well as the 7 cities, thank you all for being here, and Freddie Gonzalez will now do the Spanish translation.
Buenas tardes. Este va a ser el resumen en español de la conferencia de prensa de hoy, el 26 de agosto. Empezó hablando el presidente de la Junta de Comisionados del Condado, Zembower, repitiendo lo que ha mencionado antes de los $82 millones que el Estado de la Florida dio al Condado de Seminole, que va a ser usado para los fondos de CARES en el punto para ayudar a la economía que fue afectado por el COVID-19 pandemia. Mencionó que esto va a ser para un paquete de alivio para ayudar a las pequeñas empresas, los residentes, las organizaciones sin ánimo de lucro y las 7 ciudades del condado. Vamos a dedicar el 100% de ese dinero para el paquete de alivio de Seminole Cares, a ayudar a las empresas, los residentes y organizaciones sin ánimo de lucro en todo posible. Vamos a estar dedicando $10 millones para el paquete de pequeñas empresas, $7 millones para los residentes y $3 millones para las organizaciones sin ánimo de lucro. Mencionó también que la semana pasada empezó las aplicaciones para el fondo de las pequeñas empresas y había un total de 3.300 aplicantes y había 1.458 que terminaron el proceso de la aplicación. Esta mañana a las 10 de la mañana abrió el nuevo portal también para el fondos, pero para los residentes. Desde que abrió a las 10 de la mañana hasta ahora, hasta la 1 de la tarde, había 6.000 que aplicaron. Solo 20% de esos 6.000 recibieron un correo electrónico porque hay problemas técnicos en este momento con el proceso, pero si pueden tener paciencia que van a estar recibiendo más los correos electrónicos como va en el día. Están en el momento arreglando las situaciones técnicas para ir el proceso más rápido. También le pedimos que no haga más cuentas o no haga más aplicaciones en el momento si hicieron uno y no recibieron un correo electrónico, porque va a causar más tardanza en el proceso de la aplicación. También decimos los residentes que son dueños de empresas en el condado deben elegir uno de las 2 aplicaciones, de residentes o de las empresas pequeñas, pero no debe usar los 2 porque es uno o el otro y no se permite aceptar las 2 aplicaciones. Para las aplicaciones, el fondo de los residentes, el punto es que pueden recibir hasta $5,000 por casa, y los fondos es para ayudar lo que tiene alquiler, la hipoteca, para el gas, la electricidad o el agua que tienen de gastos. Pero estos pagareces no va a ser directamente a la persona, sino a las compañías o el dueño de la casa o lo que están cobrando estos gastos. Va a ser solo una aplicación por casa. Y a la misma vez también empezamos la semana pasada 2 líneas telefónicas para ayudar con las preguntas y con cualquier complicación que pueda tener en el proceso de estar en la aplicación. Para las pequeñas empresas, el número va a ser 877-298-3539. Y para las aplicaciones para los residentes, el número va a ser 877-330-1818. Pero sí te pedimos que no llamen hoy o en los próximos 24 horas en el sentido si necesitan ayuda por el atraso que no recibieron un correo electrónico confirmando la aplicación. Porque todavía estamos trabajando en el tardanza, pero se va a arreglar pronto. Y si no reciben nada en los próximos 24 a 36 horas, ahí entonces pueden llamar a dejarnos saber la situación que está sucediendo. También en nuestras redes sociales vamos a estar dándole más información cada hora al que es el proceso en arreglando la tardanza de las aplicaciones de hoy. Él también mencionó que había 10 bomberos que mandamos del condado de Seminole a la área de Texas y Luisiana preparándose para ayudar durante el tiempo del huracán que está de camino. Después vino el director médico del condado de Seminole, el Dr. Todd Husty. Él empezó a hablar de la importancia de usar la mascarilla y enseñó que desde que pusimos la orden ejecutiva para usar la mascarilla, los casos diariamente está bajando poco a poco y mejorando cada vez más. Él sigue mencionando que da más habilidad a las personas salir y tener más libertad, hacer lo que tiene que hacer si cada uno usa su máscara y tiene más protección en lo que pueden hacer. Y últimamente habló la directora del Departamento de Salud, Donna Walsh. Empezó hablando que el estado de la Florida ahora tiene 608,722 casos y hay 10,733 fallecidos. En el condado de Seminole tenemos un total de 7,839 casos y en el momento tenemos 692 casos activos. Desafortunadamente tenemos 169 fallecidos y en total había 550 hospitalizados, pero en este momento solo tenemos 77 personas hospitalizados. Había una tasa de positividad durante todo este tiempo a un 10.56%, pero en los últimos días ha bajado a un 3.9%. Y está enseñando que de cada 100 personas hay 1,661 casos y cada 1,000 hay 16.61 casos. También mencionó que todavía siguen las pruebas que pueden usar para el COVID-19. El Departamento de Salud tiene todos los martes y jueves de 11 de la mañana hasta la 1 de la tarde. El Home Depot que está en la ciudad de Oviedo también tiene todos los días de lunes a domingo para hacerse prueba. Y también está trabajando con True Health que está dando pruebas de lunes a viernes. También está el Departamento de Salud bien enfocado con las escuelas para seguir ayudando en el proceso de empezar el año y limitar el número de casos, porque vimos en total había 49,000 casos de personas que tienen 18 años o menos por el estado y están enfocados en eso para que esos números no sigan subiendo. También mencionó que siga usando lo que estamos recomendando, que es usando la mascarilla, distanciamiento social y siempre lavándose las manos cuando puedan. Estamos recibiendo 30 a 40 casos por día, que es mucho menos que lo que estamos recibiendo en los últimos meses. Finalmente, si tienen alguna pregunta o quieren alguna prueba, pueden ir a llamar al Departamento de Salud al 407-665-3000 y pueden elegir la opción 1. Y finalmente también si tiene alguna pregunta del fondos de CARES, de lo que estamos haciendo con el tema del virus o cualquier otra cosa en el condado, pueden llamar al 407-665-0000 y a la misma vez pueden visitar nuestra página de web que es preparesemino.org. Gracias.